Hello everyone, now let us discuss about CPC mock question from case studies. Coming to the question, operative report indicates diagnostic laparoscopy. Location is hospital inpatient. Preoperative diagnosis are chronic pelvic pain with history of adhesiolysis. Post-procedural pain. Post-procedural chronic pelvic pain. Post-operative diagnosis include chronic pelvic pain with history of adhesiolysis, then thin pelvic adhesions. The procedure performed is diagnostic laparoscopy with adhesiolysis. Anesthesia is general endotracheal. Estimated blood loss is less than 1 ml. The fluids are 120. Urine output is 50. Complications none. Findings indicate thin film adhesions in the pelvic and the small bowel, which were lysed. Thin film adhesions in the pelvic and the small bowel which were lysed, and then the omentum was adherent to the abdominal wall. So two adhesions are there, the pelvic adhesions and bowel adhesions. Both are post-procedural. Coming to the description of the procedure, the patient was prepped and draped in the lithotomy position under general endotracheal anesthesia and the bladder was straight catheterized. A sponge stick was placed in the vagina. A 1 cm transverse infraumbilical incision was made. The Veress needle was placed in the abdominal cavity. Abdominal cavity was insufflated with 3 liters of carbon dioxide. The Veress needle was removed and the sharp trocar and sheet placed in the abdominal cavity under direct visualization. Sharp trocar was removed. A light scope was reinserted in the abdominal cavity. The pelvic contents were inspected. The findings were omentum was then adherent to anterior abdominal wall. However, small bowel appeared normal except for thin film adhesions. A 0.5 cm transverse mid-abdominal incision was made and the sharp trocar was and the sheet were placed in the abdominal cavity under direct visualization. Sharp trocar was removed and the blunt probe was placed in the abdominal cavity and pelvic contents were inspected. The findings documented in the photographs. Liver and gallbladder could not be visualized because of the adhesions of the omentum with the anterior abdominal wall. Appendix was surgically absent. The patient had thin film adhesions of the small bowel to the vagina apex. These were lysed with a blunt probe without difficulty and the operative site was hemostatic at the completion of the procedure. The carbon dioxide was evacuated from the abdominal cavity. Instruments were removed from the abdominal cavity under direct visualization. Skin incisions were closed with 4O plain suture. Incisions were injected with 0.5% Marcaine with epinephrine, 10 ml. Bandages were applied. Sponge stick was removed from the vagina. All sponges and needles were accounted for at the completion of the procedure. Patient left the operating room in apparent good condition after tolerating the procedure well. Now in the CPT index, first you need to go for adhesions because adhesions are lysed here. Under adhesions, intestinal. Under intestinal, enterolysis. Under enterolysis, it is a laparoscopic procedure. So intestinal enterolysis laparoscopic. The CPT is 44180. This is the correct CPT 44180. If we go for the description of 44180, it indicates it comes under laparoscopy. 44180 indicates laparoscopy surgical enterolysis, freeing of the intestinal adhesion. And the important point is surgical laparoscopy always includes the diagnostic laparoscopy. So here surgical laparoscopy is performed though the patient presented for diagnostic laparoscopy. Because of the lysis of adhesions, surgical laparoscopy is performed. So surgical laparoscopy always includes diagnostic laparoscopy. So the correct CPT is 44180. Under adhesions, if you see bowel, it says see adhesions peritoneum. So under adhesions peritoneum, It is a post-procedural adhesions. Under peritoneum, post-procedural indicates K66.0. So this is one ICD code, K66.0 for post-procedural bowel adhesions. Next, pelvic adhesions are also seen. Under adhesions only, if you go for pelvic, under pelvic it will be female, under female post-procedural. The code is N99.4. K66.0 N99.4. Additionally, patient is having post-procedural pain, chronic post-procedural pain. So if you go for pain, under pain, if you go for chronic, under chronic you can find post-procedural. For chronic post-procedural pain, the code is G89.28. So these are the ICDs that we must report. K66.0, N99.4 and G89.28. If we go for the options, the pathology report later indicated pelvic adhesions, normal pathology. What are the correct CPT and ICD codes? The CPT is 44180 and the ICD codes are K66.0, G89.28 and N99.4. So option A is the correct answer for this particular case study. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.